going to be your nurse today. I'm going to go ahead and provide myself with some hand hygiene and provide us with a little bit of privacy. Can you go ahead and verify your name and date of birth for me?
Kate Hudson at 7 and 9.
Great. And that looks great. Ms. Hutchinson, I'm going to be in today to do a full head to toe assessment on you. Will that be okay? Okay. And can you tell me where you are now?
I'm in Dublin at Middle Georgia State.
Okay. Can you tell me what year it is?
It's 2025.
Can you tell me the current president?
Donald Trump.
Okay. Okay, and can you also tell me, have you had any recent brain injuries?
No, I'm not.
No recent brain injuries. So we do use what we call the Glasgow Coma Scale to measure any recent brain injuries or any injuries that you have had to your brain, okay?
Okay.
So use the Glasgow Coma Scale for that. And patient eyes is spontaneous and moves with me and responds, okay? Also, can you raise your right hand for me, Ms. Hutchinson?
Oh.
Okay. Thank you so much for that. Raise your right hand for me. And also, Ms. Hutchinson, I'm observing here and I'm looking at your hair. So I see that your hair is normal and I don't see any lesions or anything, any messes on your scalp, okay? I'm just gonna take a brief look here. Hair is intact. Okay, I don't see any raises or anything, no signs of any alopecia or anything like that. Are you having any hair loss? Are you experiencing any hair loss?
No, I haven't.
Okay, any dryness of skin in your head?
No.
Okay. Okay, so what I'm gonna do now, Ms. Hutchinson, is take a look at your ears if you don't mind.
Okay.
Okay. Have we had any trouble with ear drainage?
No.
Not ear infection or anything? Okay. Also, Ms. Hutchinson, have you had any nasal drainage?
No.
No nasal drainage. What about any drainage or any unusual things going on with your eyes?
No.
With your vision? Nothing with your vision? Okay. And are you experiencing any muscle spasm?
No, I'm not.
No muscle spasm. And when is the last time you used the restroom?
This morning.
Okay. And did you urinate as well as have bowel movement?
I did.
Any difficulty with either one of those?
No.
No constipation or diarrhea? Okay. Any tenderness in your abdomen area?
No.
Okay, you said no muscle spasm or anything? Okay. So can you please just go ahead and put your finger on one of your fingers on your left nostril for me? And just breathe in for me normal. Okay? And do the same thing with the right nostril.
Okay.
Okay? And I am gonna look in your mouth. Any difficulty swallowing? Okay. Tongue is moist. Are you missing any teeth? I don't see any missing teeth. Okay. Also, Ms. Hutchinson, I'm gonna check if you just extend your head to the right a little. Checking for jugular vein distension. No jugular vein distension on that side. Also, rotate your head to the left. No jugular vein distension on this side. And I'm also gonna check here. Can you swallow for me? Alright. I'm gonna perform what we call the whisper test. Okay. MGA. Can you repeat that what I said to you?
MGA.
Okay. And I did perform what we call the whisper test just to make sure everything's okay with Miss Hutchinson's hearing, okay? So Miss Hutchinson, what I'm gonna do now, I've accessed everything up top on you, okay? What I'm gonna do is I'm gonna move down and just check now for edema, okay?
Okay.
And you haven't any swelling or anything?
No.
Okay. And skin is intact and warm. Feels normal to touch. Okay. Now I'm gonna check your capillary refills, okay?
Okay.
And they're less than 3. Check your capillary refill. Less than 3. I'm also going to check your lower extremities for edema too as well, okay? No edema present. No edema present. And also, Ms. Hutchinson, are you having any shortness of breath?
No.
Any chest pain?
No.
No shortness of breath or chest pain? Okay. In the event that you were having shortness of breath or chest pain, we could teach you what we call the using our incentive spirometer method. And what you would do with that is you would breathe in 10 times a day, 2 to 5 seconds at a time. Can you repeat that what I said to you?
Inhale 2 to 5 seconds, 10 times a day.
Okay. And that will alleviate some mucus and to loosen up any mucus if you were to have any with coughing. And we also have what we call the turn, deep breathe cough method. So you would turn to your left side, turn, deep breathe, and cough. And that would help break up any mucus if you were to have a productive cough, okay? Okay. So now what I'm gonna do, Ms. Hutchinson, is just check your respiratory. Okay. Your respiratory rate is a 16, so that is normal. Okay. Now what I'm gonna do right now, Ms. Hutchinson, is I'm gonna go ahead on and start on the respiratory assessment. And this is your right upper, left upper, and this is your left lower, and this is your right middle. Okay. And also, here, could you put your, and this is your right lower, and this is your left lower. Okay. And I'm going to also do the same thing in the back, okay, the posterior. If you could just breathe normal for me. Okay. And this is your right upper, left upper, left lower, and right lower. Okay. And you can turn back around for me and relax. Okay. So now what I'm going to do is I'm going to go into the cardiac part of the assessment. And this is your pulmonary, aortic, I do apologize, pulmonary, Erb's point, S1 and S2 is present. If it was not present, I would turn over my stethoscope and assess with the bell for heart murmurs, tricuspid valve, and this is your mitral valve, also known as apical pulse. And I can check for your pulse here. And other areas that I could check for your pulse, which plus is 2 plus, so that's normal. Other areas that I could check for your pulse would be your carotid artery. I can check here for your pulse. I can also check for your axillary for your pulse up under your arms. I can also check your femoral for your pulse. I can also check your popliteal. I can also check on your radial pulse, and I can also check in your brachial area, and I can also check on your dorsal pedis, and I can also check on your tibial posterior. Okay, so those are the different locations that I can actually access pulse. And also, Ms. Hutchinson, what I'm going to do today is I'm going to have you to do before I go into that though, I am going to go in, since I have you sitting down already, I'm going to check your abdominal area, okay? And at first, I'm just going to inspect and take a look. And I do not see any distension, and I do not see any masses, okay? So what I'm going to do is, I have already looked, so now I'm going to listen. And this is your right upper, your right lower, your right upper, your left upper, and your left lower. Okay. So I'm also going to check in for your aorta for vascular sound, okay, in your stomach. And I'm going to check using the bell. Aortic, renal, iliac, renal, and iliac. Okay. And I do not hear any flatus or any brute in your stomach. And you did tell me that you have used the restroom today, correct?
I have, yes.
I did not notice any distension, nor did I hear any abnormal sounds in your stomach, okay? So now, Ms. Hutchinson, if you would just please stand up for me. Oh, before I do that, I do apologize. I do need to assess Perla, which we checked. This is for vision, okay? So. Okay. Eyes is restricted, equal and round, reactive to light, and then measure to 3. And can you just please follow this, my phone? So everything looks good with your eyes, Miss Hutchinson. So what we're going to move into right now is we're going to do, I'm going to have you to stand up.
Okay.
And we're going to do a gait and balance assess, okay? So if you could, please close your eyes. Relax your hands by the side. Close your eyes for 30 seconds. And can you please walk towards me? Open your eyes and walk towards me. Okay. And will you please walk back to your seat? Okay, this time, Ms. Hutchinson, what I want you to do is I want you to close your eyes and walk towards me, but this time I want you to crisscross your feet, just crisscross, okay? And then you can turn and then walk back towards me. Patient is not at fall risk, okay? And you can just have a seat for me now. I'm going to access your range of motion, okay?
Okay.
Okay. So what I want you to do is hold your hands up like this, and this is called supination.
Okay.
And I want you to hold your hands down, and that's called pronation. And see if you can lift up on mine. Okay. And see if you can press down. Okay. Thank you. Okay. Okay. Let's go for range of motion. You can relax your hands. Okay. And also, Ms. Hutchinson, what I want you to do, I want you to flex your, do your elbow like this. This is going to be flexion, extension. Then I want you to draw it back, and this is going to be flexion. Okay? Okay? So I want you to do like this, and I want you to press down on my arm. Okay? And I want you to press up. Okay? Also, Ms. Hutchinson, that was a range of motion for your 2 upper extremities. I'm going to now access your 2 lower extremities, okay? And we're going to do your toes first, okay? So if you just keep your toes down, that is extension. And if you bend your toes, that is flexion.
Okay.
Okay? So I'm going to have you to apply small pressure on my hand, okay? And I want you to do the same thing on the apply small pressure. Same thing on the other. Okay? And down for you. So what we're going to do now is we're going to check your knees, okay? So if you would keep them like that, that is extension. If you hold it out, that'll be hyperextension. And if you flex it back, that would be flexion. Okay? So let's see if you can. Okay? Good. And then press back. That's good. Same thing. Okay. And then press back for you. Okay. So that concludes our head to toe assessment. Do you have any questions for me?
I'm all right.
Okay. Thank you so much.